Well, hello everyone. I'm hoping you're having an opportunity to grab a bite to eat during this lunch hour. My name is Mary Funset, and I will be your host today. Today we are collaborating with the Richland Hospital, and we look forward to sharing with all of you the work that's getting started, and to welcome you all into this conversation today. You're going to, those of you who are on the phone, know that there is a large group over there in Richland County at the hospital listening together with our speakers, Ty Mulholland and Marcia Carlson. So we're going to get started. First of all, just to welcome those on the phone. I can definitely see at least one person, so I'm not sure if some folks are listening via telephone. So let's start off with Nancy Chudy. Are you available to say hello?
Hello.
Very good. So Nancy is works for the Department of Health Services, and she is the epidemiologist there, and she coordinates and collaborates with us at Metastar on a variety of projects. So we've asked her to attend so that she could listen in to hear about this great work that's going to be happening in Richland County. So welcome, Nancy.
Thank you, and I'm looking forward to the description of the project.
Great. So is there anyone else on the line with us, with the exception of all the folks over there in Richland Hospital?
Martha White.
Hi, Martha. And who do you represent?
I represent myself. Linda Simmons invited me to find out about this happening. I need something constructive to do during my retirement, and I'm a good workshop leader, so I thought maybe I could find a way to fit in.
Oh, that's fantastic. I look forward to meeting you and hearing more from you. Who else is on the phone with us today?
Hi, Mary. This is Pam Van Kampen from GWAR.
Hi, Pam. Yes, Pam has been asked also to join us. She works. Pam, tell us, what is your background at the GWAR, and what is the GWAR for those who don't know?
Thank you. Greater Wisconsin Agency on Aging Resources. We're an area agency on aging that works with 70 counties and 11 tribal aging units around the state. So specifically working with Richland and Vernon County for this project, and Sauk possibly for an expansion. I'm a dietitian, but I also work closely with the nutrition program and the senior centers throughout the state.
Fantastic.
I'm also, thank you for letting me be on.
Yeah, thank you. Anyone else on the call? Okay, so we will get started then, and as at the end of the call, we will be able to take a second roll call just to see if anyone else has joined us a little later. At this time, just a couple of housekeeping things. We are not going to mute lines today unless we run into any technical problems, and then I will be able to mute our lines. It won't mute yours, Marcia, but then what will happen is I will be able to unmute them as well. For now, we'll leave them open, but if for some reason we have to go into mute mode, then if any of our participants has a question, and if you happen to be utilizing a computer at the same time, you can use the chat function to get in. Otherwise, know that we will reopen the lines fairly quickly so we can have folks continue to participate verbally and share ideas, questions, and suggestions at the end of our presentation. So today, know that our presentation is being recorded, which will be an opportunity for us to share with others who were unable to attend today. We have a group growing already that are very interested in participating with us, and we'll share that in just a moment. So today, our objectives are listed as follows: that we're going to understand the desired impact of providing a county-wide diabetes prevention and informational courses. We're also going to make sure that we share knowledge about the needs of the residents in Richland County who have diabetes, pre-diabetes, or may have concerns about diabetes in general for themselves or for the folks that live there in Richland County. Nationwide, I just would like to let you know there is a focus on diabetes. I'm sure you've all heard about it in the national news and locally. But we also have a national focus on the community supporting each other. So this is a really neat project that has been created by our co-host, who I'll introduce momentarily. And just a reminder again that we will be offering an opportunity for you to provide us with your questions. Also, we're hoping that you're going to have lots of questions as well as some thoughts and some ideas of how this should move forward. Know that our conversation today is about just to, first of all, make you all aware. But from there, we will grow to action items as we move along in the next few months. And know that everybody can have a voice here. Not everybody needs to be one of the moving parts of this unless they want to be. Sometimes this is a case of just passing on the information to another or sharing your ideas and thoughts. So, again, we're so grateful to have everyone here on the call today. So at this time, I would first of all like to welcome my co-hosts today and the leaders of this project, Marcia Carlson and Ty Mulholland. Both are from Richland Hospital. They will introduce themselves and their background. And then also, Marcia, give us a little idea of how many folks that you have sitting in the room with you over there in Richland Hospital.
Sure, Mary. Hi, my name is Marcia Carlson, and I'm a registered dietitian and diabetes educator. I work at the Richland Hospital, seeing patients in the clinic and in the hospital, and have a strong interest in diabetes prevention and community-focused activities. We have 4 others here with us, some of our nursing staff and physician and administration, so we are very happy to welcome them.
Hi, everybody. I'm Ty Mulholland. I'm also a registered dietitian and certified diabetes educator at the Richland Hospital. And I am the head of the outpatient diabetes education program that we have approved through the American Diabetes Association.
Marcia, would anyone in the room with you like to share anything in this introduction slide?
Dr. Jenny coming.
Hi, I'm Dr. Jennifer Mishkowski. I'm a family physician at the Richland Medical Center and also have privileges at the Richland Hospital. And I just have an interest in diabetes. And I'd like to see more done in the community to try to prevent it rather than having to depend on everybody coming into the clinic.
Thank you.
Anyone else, Marcia? Or is that it for now?
Yeah, that's it for now. Maybe after we're done with lunch.
Okay, that sounds fine.
Okay.
All right. So one moment. I'm just trying to make my slides move here. And it's stuck. But there we go. All right. So let me give you a little background about why Metastar and who Metastar is and why we're joining together with Richland Hospital and the Richland Medical Center. So first of all, Metastar is a quality improvement organization. Our tax dollars pays the federal government, and they take those dollars and they return them to various projects, as you all know. One of the projects that they have in funding sources is the fact that CMS, the Centers for Medicare and Medicaid, for the monies to create a quality improvement program for all of healthcare here in the United States. Metastar has been around for about 40 years, and we work closely with all sorts of clinicians and all sorts of organizations that represent healthcare today. We're those silent partners, those that generally go unseen. But we're here working shoulder to shoulder with them and offering opportunities within organizations to receive resources that they may not otherwise have access to or may not be aware of. So we're here as a partner with Richland Hospital and Richland Medical Center. We are part of a larger group, which is called a Quality Improvement Network. We work together with Minnesota and Michigan doing all the same work. So we get to focus locally in Wisconsin and even more granularly locally by focusing in a place such as Richland County. But then we also receive assistance and resources and advising from Minnesota and Michigan, who both also are working closely together on diabetes with organizations in healthcare. So as I mentioned here, we get funded by the state and federal governments. We also have private contracts too, but primarily the focus that I work for, as well as the group that's working directly with Richland Hospital, we happen to be the Medicare team, and we have the various tasks listed here. So there's things like adverse drug events tasks, there is cardiac care work being done, care transitions, which means reducing the readmissions back to hospitals, diabetes education, infection control, primarily in the surgical area, nursing homes, working very closely with them, and then also working with folks to work harder, or not harder, but do better with reporting their PQRS and meaningful use measures. PQRS stands for Physician Quality Reporting System. So reducing disparities in diabetes care is our primary focus in my department, as well as why I have asked Richland Hospital and Richland Medical Center if I could join them with their work. So we are working towards overall with an initiative nationally that's called Everyone with Diabetes Counts. That's something you can actually Google. I apologize, I didn't put the web address here, but it is something you can Google if you would like to learn more nationally on how this is happening. But one of the things is to work together with clinics and hospitals and community centers and any parts of the community. So we are going to, through Every Diabetic Counts, we want to make sure that people who have diabetes have the opportunities to, as this slide says, effectively manage their chronic disease. We want to empower patients so that they understand where the resources are, why their doctors are asking them such questions, and why are we also interested in A1Cs and good health and good eating and exercise and so on. Overall, we want to together collaboratively improve clinical outcomes for those who don't have diabetes, but know that if you are diabetic, pre-diabetic, you're definitely being closely watched for your A1C and your lipids. We want to ensure that folks are getting their eye exams done, their weight taken and monitored, as well as that blood pressure control and foot care. We want to ensure that we are increasing the opportunities in the areas that people live, that they can feel supported so that they can go about what they hopefully will do best for themselves, which is manage their chronic disease. As you all know, especially the physicians there, you can prescribe and consult and suggest all you want, but often, patients come back with no results, or things are perhaps getting worse. So we are working simultaneously, not only with the organizations, but we are too reaching out to the community to see what we can do to help support people in community. So this project that Ty and Marcia are embarking on definitely is going to be the right project to help support things. So, Marcia, I'm going to pass you the ball at this point. Give me 1 second.
Yeah, you see the slide that is the goal. Working with Mary over the last several months, we developed a mission statement and a goal for this project. And our goal is we will be working with the Richland County Health and Human Services and with Medistar to develop a peer network in Richland County, Wisconsin. Our goal is to have this network offer free educational diabetes empowerment educational program, otherwise known as DEEP, DEEP, and community linkages and resources in order to reduce disparities for people at risk for diabetes by November 1st. We would like to have our network in place and maybe an event planned by November 1st, 2016.
And just a little background on DEEP. DEEP is a peer network provided program. It's evidence-based. It's similar to the diabetes prevention program, series of small group classes, and facilitators are trained and have professional backup, but they're generally community members and local people who would be facilitating this program. And I will say more about the local goal of our group as well. Our target group is people concerned about diabetes who do not have access to clinical diabetes education or diabetes self-management education. We know that people who have access to diabetes self-management education are insured, or they have Medicare, they have a way to pay for that because financially that's a barrier for people participating in our program if they don't have that. They also have been diagnosed. There's not resources for people who are not yet diagnosed with diabetes that are covered by insurance currently. We also know from a survey we did during Diabetes Month that transportation is one of those barriers to people actually participating in their diabetes care. We really wanted to target on people concerned about diabetes, people at risk for diabetes, and generally anyone in our communities who wants to learn more about diabetes. We do not want to limit the target group to anybody who has a diagnosis because we know 30% of people with diabetes are not yet diagnosed, and many, many people have pre-diabetes who are not diagnosed. So that is a little bit about our target group. I'm trying to get the slide. There we go. That we are focusing this project on. Looking just a little bit about Richland County as a whole and our health situation through county health rankings. We're pretty much right in the middle as far as health factors go. Some of the things that kind of stand out that we'd like to target on, and maybe some of you are familiar with this, is that for health behaviors, I know this is kind of small, you can go on the countyhealthrankings.org website if you want to know more about these measures. I like data. I could spend hours in there. It's really interesting stuff. But that tells you how they came about this and where we stand in relationship to U.S. performers in Wisconsin as a whole. Physical inactivity, we know that's low for everybody. We're kind of right on track there that we have a physically inactive population. Our food environment index is 8.1. You'll see that kind of down on the list there. That takes into account people's access to healthy food and their distance from grocery stores and things of that nature. So we're kind of in the ballpark for Wisconsin as a whole. That doesn't mean it isn't still something we want to target as a group eventually. These are, Mary, do you want to answer that question?
Sorry, can you repeat the question, please?
Are these the latest health rankings? We were just notified last week that there were updated ones out. I just wondered if...
It probably isn't. So this is most likely the most recent, right before that update.
Yes, and I did as well see the 16 ones on the website right now. So you can go and look at those. They're a little bit different. But
yes, and at the very top, as you can see, folks, you can go out to, for those who aren't aware of county rankings, it's fascinating. Yeah. It's the website is at the top of the slide.
I'm having trouble changing my part. Did it go? Okay. There it is. Part. Okay. Thank you. Okay. Clinical care. We're not too bad there. We're right in the middle. You can see it's interesting that is the ratio of physicians to, or population to physicians, dentists, mental health providers, other resources in our community. Diabetes monitoring, 91%, that looks great, but it is the percentage of Medicare enrollees diagnosed with diabetes who actually have 1A1C done. So it doesn't tell the whole story, but you know we're right on track there as a county. Some of the interesting things that
I thought we have more children in poverty, although our unemployment, our economic, and high school graduation rates are fairly equivalent to the state as a whole. Our access, I can't remember what slide it's on, but anyway, our access to physical activity opportunities was much lower than other communities in Wisconsin by quite a bit. So that's something we would like to partner with resources in our communities to try to increase that access and understand a little bit more. Another thing I thought that our community should be aware of in Richland County is this long commute. We have 29% of Richland County who have long commute driving alone. COPS performers are much lower, and the state as a whole, that's much higher than other areas of the state. So those are some factors, looking at those, and also the numbers of persons with diabetes in Richland County, which is not on this slide, but from some of the report, the burden of diabetes, that there are about 9% of our population has diabetes. 30% are not yet diagnosed. So that would be about 1,800 people in Richland County who actually have diabetes. We know that only about 7% of those actually access their benefits for diabetes self-management education. So that's something we'd like to understand and be able to provide. As we know, transportation, financial, those all factor in there. Perhaps offering those in community with a peer network support person would help bring that access out to the community. Additionally, there's estimated 4,700 people in Richland County with prediabetes. I don't know how they found that number out, but that's what they say there are. And I imagine that's underestimated because we know there's a lot of people, very many people at risk for diabetes. Does anyone have any comments or anything on these? Any questions? As I said, it's really fascinating to kind of look at how we rank in our services and what we provide in Richland County. So how do we reach those who are at risk, this large population of people who are out there who aren't coming, and how do we help them try to back up the train and prevent diabetes in a community-focused way? Well, what we would like to do with this project, Richland Aware, is to provide improved access to diabetes health counseling for people at risk. We'd like to extend the reach of the health resources that we have to rural Richland County. And we also like to create links between existing resources. We know there's a lot of people out there doing things. We know there are a lot of people who are interested. We'd like to bring people together to try to make this more of a reality for the people that we aren't able to reach. And I'll let Ty talk about some of the programs that we currently have.
So as I mentioned earlier, the Richland Hospital does have an ADA-recognized diabetes self-management education program, and we've had that for a number of years here at the Richland Hospital. In conjunction with that, we do hold a free diabetes support group monthly. We've varied times, we've varied days, we've gone from PMs to afternoons to try to increase the number of people that attend, but we do feel that significantly more people could benefit from that program than do attend. The Richland Medical Center has a Food for Life cooking class that's very popular, doing very well, and it's going to have a bit of a restructure coming up on its format. Grocery store tours are something that Marcia and I are doing monthly at this point. We go to Gordy's, the local grocery, and one month we do an afternoon session, and the next month we do an evening session. And we do pre-assessments, expectations. We try to hit those, so people that do have diabetes very often will comment on their questionnaires, what would you like to learn about today? So we gear those towards the interest of the group. Our senior meal sites are very active in our community, and then we have Richland Fit in our community, which too ties together resources. It's a grant program, that tries to increase activity and nutrition awareness. They both have an activity grant and a nutrition grant in order to increase health and wellness in our community.
Mary, I'm going to pass the ball back to you now.
Okay, terrific. So, as Marcia mentioned, one of the opportunities we have or strategies that we believe will be helpful to creating this peer network and this opportunity for resources for everyone is that we would like to create some workshops in your area. These workshops would be free of charge to the participants, and those who would become what we call peer educators for the workshops, they would be volunteers, they would receive free training, and they would be receiving a certification. It's not like the same certification, of course, that's extensively long to get, right, Marcia and Ty, to become a certified diabetic educator. But what it is a certificate that says that you have been trained to become a peer educator for people who have either a concern about diabetes, pre-diabetes, or perhaps they are caring for somebody who has diabetes. All across Wisconsin, there are free workshops going on, and they are similar but not as extensive as the billable classes that you can take through your, for example, with your hospital when folks come to see Marcia and Ty. They do not compete whatsoever with the billable programs in all the different clinics and hospitals around Wisconsin, but instead they actually enhance it. What truly happens and what has been found to happen across the nation, where there are obviously both these workshop types as well as the billable programs for self-management, what we're doing is we're ensuring that during the workshop, if a person would say start in the workshop area in the community, during the workshops, one of the weeks they would actually go over who's important in your life if you have diabetes or may have pre-diabetes or are concerned, and it talks about the various caregivers and clinicians that are participating in your health and the types of tests and services that you need as well. They encourage the patient to consider to utilize what is being prescribed for them. They also can encourage them, if their insurance coverage covers it, that they can come in and receive additional services and a little bit more specifically planned out program for themselves by the clinicians. MetaStar is the organization currently in Wisconsin that is training people to become peer educators. Because we are piloting this in Wisconsin, and we have and are collaborating with Richland Hospital and this project, we are going to be offering, as I mentioned, the training. It will be free of charge, and the certificates for those who graduate will then have those covered. There is a plan in place that Wisconsin-wide plan in place and also nationally, that in the future, if this is something that works out well for organizations, that we can train additional organizations to have peer educators and or hold their own license. MetaStar itself has a learning and action network. So whether you're a clinician working for the hospital or the clinic there in Richland County, or if you're working elsewhere in other organizations around Wisconsin, we have learning and action networks going on all the time that provide a wide range of topic areas, and very specific around those areas that I mentioned before as our task areas. And then again, on the slide, if you're looking at this via WebEx, you will see there is a link there to the Diabetes Self-Management Education Provider Toolkit, which we actually will, Marcia and Ty, have I given that to you yet for your clinicians?
Not that I can recall.
Okay, that's fine. But we will make sure that we have, an easy link sent to you so that you have it. It's also right there in the presentation. So for those on the phone, and the folks there already at the clinic and the hospital are participating, but what does it take to be a stakeholder in this particular project? As I mentioned, people do not have to take a large action plan and put it into action for the community. It may be that you have ideas or perceptions that would be very helpful to us. So whatever size participation you want to have, that is absolutely fine with us. But here's some of the ideas, and for those of you who are already participating, perhaps reaching out even further in knowing others in your community that would be good at this. But we are looking for places to help those who volunteer to become peer educators to hold these classes, to hold these workshops. So that'll be something in the future, an ask. We're hoping to have somebody willing to be the trainers themselves, be peer educators. And so far I have one volunteer that has already raised their hand and said that they would do that. And then, of course, on the call today, Martha White is hoping to participate in some way, so we can talk in the future, Martha, about what you'd like to do. We want people in your community to refer them to know that there is this peer education opportunity out there, and know that there's still that billable diabetes education out there too. So both programs are running and rolling and are the opportunities for people in your community of Richland County to participate in. Spreading the word is basically where it's at. As I mentioned, again, the workshops that we would like to present in Richland County will enhance the regular treatment programs. It is all evidence-based, and as well as Ty and Marcia have reviewed some of the aspects of it, and they will have access to the curriculum, so they know what folks are being educated about. We want to make sure that the local ADRCs, the Aging Disability Resource Centers, are part of that. Having, for example, Pam Van Campen on the phone with us today, her nutrition site managers and directors around your area have been made aware and are going to be participating more in the future and offering us ideas on what makes this go as smooth as possible. And then, of course, I can't say enough about the opportunities for folks who will attend these peer education opportunities. I have provided a few classes so far and gathered together some elders in my small community of New Glarus, and the outcome was terrific. I had 9 individuals in one particular class, and there was 8 ladies and one gentleman, and of the group, half of them had diabetes, one had pre-diabetes. The others who did not, they were just concerned and they were interested. By the end of our 6-week workshop, it was exciting to hear them talk more about a better understanding of why we eat food and what foods really help them more feel satisfied as well as more energetic and healthy. One of the women came away and she said, I have not lost weight in years, and I've been wanting to get into the size 12 dress. She said she made it by the end of the workshop, and she was very, very excited about that. To see a woman who is 88 be thrilled about that, it was very enjoyable to hear what she thought. People never really understood how to portion their food on their plates. They learned about that, and we learned some very simple ways to do that so that they didn't have to learn how to use a computer or get guidance from Weight Watchers necessarily. Not that that's a bad thing, but they learned how to do it simply by using their hands and using their hands as a guide, and this was very beneficial to the group. At this point, we want you to consider your questions and pose those to us at this time, as well as any suggestions that you may have for us as we get going on this project.
Martha White, I have a question.
Yes.
Yes. Is there a way that we could focus some of these that have a high component of the exercise component to it, that it's more movement oriented way, that there'd be more activity periods for exercise interspersed within the teaching of the concepts, so that it's an interval training kind of thing, so that you're having people not sit too long?
Certainly. I think we have to gauge that according to what folks are able to do in the classes. Those who attend the classes are of all ages, and we're focusing on adults, of course. Some folks are able to engage, and there is a module specific about exercise and movement and the importance of that. So we caution workshop peer educators as to how to handle that. So it's a very good question, Martha. Before I move on with that, I just want to mention that the evaluation has been put up. So if you could, who are on the line and using your computer, complete that for us as well, that would be helpful. Martha, did I answer your question?
Well, generally, but I guess my whole thing is, what I find for most peer things is that for most of us that come from a sedentary type lifestyle, to get into the mode of learning to think of having more movement to help us manage our chronic diseases, that if we could have it where when we're learning things that we're not sitting more than half an hour at a time.
Oh, sure.
So that we can have a stretch. And I mean, I'm talking about little exercise breaks, nothing major, but to change the focus from these being the traditional talk at lecture type. I just find that there's not enough
hands-on
demonstration.
Yes. Well, I have to tell you, now, I did not plant this woman in the crowd, but I have to tell you, this is exciting that you think that's important. So the classes, the workshops themselves, actually, that's exactly the way they are built. The workshop, the very first module talks about our anatomy. So people stand if they're able, and what they do is we make an outline against the wall with some big long paper, and we draw an outline of their body. And then we give them replicas of things like the pancreas, the liver, the stomach, the heart. And we ask them, before they've learned, put this where you think it goes. And then they learn about it, and then they rearrange sometimes because they didn't quite get it right. We talk about things like, how insulin works, and the use of balls and pins and things like that. So the hands-on activity there. We talk about in another module about how the kidneys work and why it's so important to, take care of your chronic disease. And if you don't, what happens? And for example, the way the workshop peer educators handle it is they have some strainers. And in the strainers, some of them are somewhat black, some of them are perfectly clear, and they use the use of water to show the differences. So there's a wide range of tools that we teach to use so that they can do demonstrations versus, as you mentioned, just sitting and having them be spoke to. So yes, people move around the room. They have an opportunity to try some things. I know that when I had my workshop, I brought in a couple samples. Not that it's a must, but I brought in a few samples, and I brought in something one day and explained that I used some different types of ingredients to make some good old-fashioned brownies. And I used black beans, for example, in them. The people were thrilled, and then to find out they tasted good and they got the fiber that we had talked about was so important. Those are the kinds of things that we did. Another lady did not want to continuously use her flavored creamers that she so loved. And so she says, that's one thing I really don't want to give up, but my doctor's saying I really should. There's a lot of sugar, there's a lot of oil, there's calories. So we brought in for her some chai tea, some simple Lipton chai tea. She found it delicious, and she felt like she was getting the flavors she enjoyed, and yet she was having less calories and something easy for her to prepare. So it's those conversations that people have in these workshops as well amongst their peers to hear how they made specific recipes, how and where they might have found particular vegetables or great ideas on how to store vegetables if they really can't get to the grocery store as often as they need. Those are the kinds of things happening in these workshops. And then the movement part, there is a whole module about physical activity. There's a module about mood, behavior changing, and so on. Do we have more questions?
I have a question, Nancy Chitty.
Yes, Nancy.
Is there a food pantry in Richland Center?
Marcia and Ty, I'll field that one to you.
Could you repeat the question? It was hard to hear.
Sure. Is there a food pantry in Richland Center or Richland County?
Yes, there is. Yes.
And where is it located? So if you'll repeat that, please.
A church in town. Town and Country Presbyterian Church.
Okay, change the name.
Changed the name now.
Okay.
Yeah. It's a very active.
Wonderful.
I know often there's outreach at the pantries.
You're breaking up just a little bit, Nancy.
If I know you described the grocery tours, and I know in some places there are tours like that for people with diabetes or pre-diabetes.
Yeah, there's been some fascinating work out of Fond du Lac, Wisconsin. Their food pantry actually has embraced the need to help support folks with chronic disease and especially diabetes and hypertension issues. So they have arranged and organized their pantry to have areas and help folks who have those issues shop better and help them find things, as well as they're doing outreach to the community and say things like, community, while we value the things that you're bringing to us from your pantry to our pantry, realize that we have way too many mac and cheese boxes. They had a whole entire list of what they most had received, and sadly, of course, it's some of the things that none of us should be eating.
Thank you.
Thanks for the question. Anyone else have a question?
Hi, Mary. This is Pam Van Kempen. I just have a question about the free support groups that happen monthly and the Food for Life cooking classes. Do those both happen right at the Richland Hospital, or are they remote? And if they're not remote, like in other parts of the county, is that something that the hospital is willing to look at?
The diabetes support group is located on site at the Richland Hospital. We meet the third Tuesday of the month from 2 to 3 p.m. The Food for Life cooking class.
It was held at the Richland Center High School, and then recent renovations and things, we are now holding it at Center Street, which is okay. It's also
All right, thank you very much. Because I was just thinking maybe at one of our senior centers or the meal sites, maybe if they have a kitchen, might be a nice place to offer those cooking classes. But I don't know what your availability is to do, to travel out remotely to other parts of the county.
Yeah, that's one of the reasons we really wanted to work on this peer network for those areas, because we don't have the resources to do that. So we were hoping that, maybe that's a function that could be, we could work with a peer group to provide those to the outlying areas.
So, right, even if you guys gave us like the outline or the script to follow, we could possibly find some folks to do the cooking class?
Yeah.
Is that, okay.
Yeah.
Right.
That's fantastic. Yeah, one of the things that we began with as a group, as the three of us, we brainstormed who in the community do we need to reach out to. And here's just a short list. First of all, of course, we went to Cynthia Ticker, who's part of leadership of the Richland Hospital. And, of course, we reached out to the Richland Clinic. They're right there in Richland Center. We talked with the Fitness Center, which is Simon's. And we are working with the GWAR, which is where Pam is from, but her colleague, Carrie Porter, is part of the transportation providers of the GWAR. I'm working internally with our Transitions of Care group. through Medicare, which is a group that's hoping to reduce the amount of readmissions. We will definitely bring together media, such as we're going to be reaching out to radio and the newspaper there to spread the word as we grow and get ready for more things to happen. And we have already reached out to Continuous, which is the providers, the managed care organization that is serving family care in your area. They are very interested, but unfortunately, I don't think they were able to make it today. The Department of Health Services, they are aware, and they are also ready to support us as we need to. The Department of Public Health at the county level has been asked to join us as well. They were unfortunately unable to attend. There's been some other meetings happening. And then Pam Van Kampen has introduced us to the variety of nutrition program directors in your area, which they themselves have a lot of great ideas. We are going to be, and we have reached out to a variety of providers. Unfortunately, a few of them are on vacation, so couldn't attend today, but we do work closely with Dean Clinic out of Madison, who also has services that are coming over your way. Davis and Doer. We are going to be reaching out to the Dr. Olson Family Optometry, for example, and the Lions Club. And, as you think of folks who, we should be reaching out to, you can either reach out to them yourselves or just direct them either to myself or to Marsha or Ty. On the screen currently, I have up my contact information, so I'm happy to take any questions or information from you at a later date as well. I'm going to give you my direct phone line, which I see we didn't print on here, which is 608-441-8229. I'll repeat that. It's 608-441-8229. On the screen, it shows my email address, which is mfunsess@metastar.com. So that's MSUNSETH@metastar. So it would be very important for any of you to share that information, to ask folks to give us a call, either here at Metastar, talk to Marsha, and we want to continue to think of it like building an army to work on this. And there's a variety of ways that really we could really would feel supported. Marsha, Ty, anything? Dr. Jenny, want to say anything at this point?
No. Thank you.
We sure look forward to it. Anything else from anyone on the phone?
So do you want us to contact you separately?
Yes, that would be fine. Is that Martha?
Yes.
Yeah, so give me a call, and if you don't get me personally, Martha, just leave me a voicemail. I'll return your call very quickly, or if you want to email me or both.
Okay, thank you.
You bet. And Linda has my email.
I have your email, yes.
Okay, good. Good. Yeah, so email me, and then I'll have yours, and we'll talk about that. We're definitely, folks, looking for volunteers in the community for a variety of reasons. Not only for feedback, but also we're looking for some future peer educators to help with the workshops. We're looking for folks who are just willing to help connect folks to the workshops. We're looking for folks just to even serve as assistants at the workshops. And that is something that will help get this off the ground very quickly.
Thank you, and thank you to everybody on the phone for joining us today.
Yes, thank you.
Thank you.
All right, well then with that, we are going to end our call. Have a great afternoon. I'm hoping it's still sunny outside. All right, bye-bye.
Thanks. Bye.
Bye.